sorry, we will be doing the school-based interventions for a selected population group project, and I am Tanyan Suture.
Hi, I'm Casey Womack.
So our topic selection focuses on a 12-year-old boy who we named Tyler Miller, and he is a middle school student who is specifically in 7th grade. Most of the time, middle school students come with so many challenges with it being, close to high school, and that is an experience that you don't always get in elementary school. So such as this, many teachers changing classes more often, which those ultimately ended up and in adding peer pressure to students, or as well as students spending time with older peers. Our case study student is having a difficult time staying organized with the addition of more classes and having to move from room to room more frequently than he did in elementary school. We're also noticing some different changes with his behavior in the classroom. He's being more disruptive, he's being more loud during classes, as well as the transition from one class to the other class. So one of the first interventions that for individual intervention that we wanted to talk about and kind of go over with students is the check-in check-out system. And this briefly is just the students coming in the morning with the counselor and just having tiny brief little meetings. It can be in the morning, it can be in the after once school is done, and the reason for this would be where the counselor would kind of keep track of these type of point cards that we would give to staff members that they can mark down for student behavior and teacher feedback at pre-arranged durations, which is just something that can help with the students and focus on, exact pinpoints and like what they went well, what went bad that day, just some things that the students may need to work on. And then by using a component analysis to examine the relative contributions of the teacher feedback components of the check-in and check-out system, this current study aimed to contribute to the body of knowledge for the students. And if Tyler, just wanted to talk and chit chat, we can also just do that as well as any other student. How I would personally want to implement this into a school would be to form a small intervention team with the counselors, administrations, teachers, and then we can focus on some goal setting with each type of student and what level they're at or what they're working on that week. And I have some examples too listed on the slide, but basically just trying to make sure each student is at the comfort level that they need and want in order to achieve and be successful every day. And all of us staff members, administrations, counselors want to help them get to that goal. Another intervention that I kind of looked into that was sort of a little fun one is the Caught Being Good game. This is implemented in schools to kind of intervene with the control with behavior in the classroom. It can evaluate the impact of this game can evaluate the impact on reducing disruptive behaviors and classroom behavior in students with ADHD diagnosis. This also can encourage beneficial habits in a fun and interesting way by providing constant reinforcement. Tyler would receive, or any other student would receive, like certain awards if a teacher or someone else is watching them doing something good, doing something helpful, doing something proper. And some examples could be obeying instructions, staying focused, keeping quiet. And this would ultimately just make things better for the students, and they're able to see that if they do something that they're supposed to do, they're going to get a reward right away. And a big way to implement this into a school would just to ensure that all staff understands the protocol as well as how to implement this game effectively. We can just explain the rules of the game, and then we also need to ensure that all staff members know what type of things do deserve behavior, like or treats or whatever it may be, type of treats, and just to make sure there's no problems with the rules and instructions throughout the day. And then we also would want to track some progress and make sure Tyler and all the other students are receiving feedback, whether it is positive or negative. So this is kind of an area I wanted to touch on just in case. If a school has concern about the overall alignment of behavior behavior intervention tiers, it is important to note that the implementation of the caught being good game would not interfere with the existing tiered intervention framework. And then if you guys aren't familiar with the tiers, tier 1 is refuse or refers to the core high quality instruction that is universally provided to all students. Tier 2 would be targeted interventions for smaller groups, students like Tyler, who will require additional support beyond the general classroom instruction. The Caught Being Good game system can be seamlessly integrated into both tiers, allowing for the maintenance of a positive and structured classroom environment that supports student engagement without causing disruption to either the students, individuals, or the class as a whole. Promoting resilience and optimal development for individual counseling. Counseling students, including those with ADHD, presents unique challenges. However, the success of counseling largely depends on the approach and engagement with the students. So demonstrating resilience both individually and collectively as a team enhances outcomes for students and supports staff in navigating transitions. So children with ADHD face significant challenges each part of their lives. And with tailored support, they can and should excel academically and professionally. And we, as administration, staff members, counselors, have to be able to provide them the appropriate, feedback and everything, attention, all of it. So for students with ADHD, developing resilience plays a very crucial role in helping them manage challenges such as hyperactivity, impulsivity, and inattention. So those for the students with ADHD, optimal development involves providing the right amount of support to ensure they thrive in multiple aspects of their life, which is socially, emotionally, physically, athletically, whatever they choose to do. And this just helps them with self-awareness, peer interactions, and just basic life skills for adulthood or after school.
Okay, while Tanya touched on interventions that could be used individually, we're also going to look at group interventions. She specifically outlined those as individual, but those could also be pulled into a group situation. Before we get into the interventions, I want to look at why we would use group interventions for the treatment of ADHD, specifically in the school system. I don't know if this is countrywide, but in my area particularly, we have a shortage of counselors. So we have schools that don't have counselors, and ones that do, they don't have enough. We have a pre-K-12 school with one counselor, so that's a shortage. So that would be a benefit of having group instruction or group intervention. Lack of funding in schools. So even in areas where there are counselors wanting to work, the schools just can't afford to hire them. Time restraint is huge in schools. We can generally give about 30 minutes to an hour for a student to go see a counselor. But other than that, they're interfering with academics, and that's generally frowned upon. So if we can pull several kids into a group, we can get more done at once. And this is also cost effective for parents. So we're looking outside of the school. If they're paying for individual counseling, putting them in a group setting would offset that cost a little bit. And then one big thing, it also shows these children they're not alone. So a lot of kids, especially with ADHD, they feel they're called out on a lot because they're, maybe in trouble because impulsivity or behavior, not being organized. They're generally, called out in class often. So they're able to see they're not alone. I don't think I can switch it. Okay, we're going to look at some behavioral therapy. So the goal with this is help to change behavior. Children need techniques they can use with or without medication. So we have some kids with ADHD who are medicated, but there's many who aren't. And that could be for various reasons. Maybe parents don't want to do it. Maybe, I've had students that it didn't work well for them. Maybe they lost a lot of weight, or maybe they said it made them feel worse. So we need to offer these kids something they can use aside from medication. And maybe, they're medicated now and grow into adulthood or adolescence and they choose to stop taking that medication. These are techniques that could go with them. So one of the biggest things we're looking at is techniques to aid in organization. One of the telltale signs of ADHD is just disorganization, right? We have binders with papers coming out. We have papers on the floor. We can't keep a pencil, losing homework, that kind of thing. So if we can teach these kids to stay organized, that will help them. One, it's going to minimize getting fussed at by their teachers, right? Because they're not losing everything. But two, it's going to help them academically, and then they're also going to have a better self awareness, self confidence, because they know where their stuff is. And then scheduling tools. So this is going to kind of align with organization as we help our students keep a calendar or keep a checklist of maybe homework assignments that are due, different classes that they need to be at, especially with our case study, Tyler being in middle school, he's going from class to class. So we need to have a schedule for these kids to know where they're supposed to be at certain times and what to expect throughout the day. So what this looks like, implementing this, the organizational skills training. So we are going to teach these kiddos what it looks like to be organized and how to do it. Those with ADHD often benefit from added support in the area of staying organized and completing homework. So when you're not organized, you can lose your homework, or maybe you don't even know you had homework because you didn't write it down. So if we're organized, that's going to help us keep up with it and know what's due. What I would do, similar to Tanya's check-in, check-out system, and this could work with parents too, but I would start with just the counselor. We're going to bring that binder and we're going to organize that. So for Tyler, we're going to have him a folder or a tab for each class. So that way he knows if this is English homework, it needs to be in this folder. English notes, it needs to go there. So he knows where everything is supposed to be. Without having the tabs or the individual folders, it's easy just to shove it in one like or big space and then not know where it is. And this can also, depending on the teacher, some of them are willing to help do a binder check, some aren't. And then parents, this is a great thing. Tyler can take this home. Parents can see what's going on. So if he has, a report due in social studies, the parents can easily look through that social studies tab and see where it is and help hold Tyler accountable. Task organization. So we're going to teach working through tasks. So going back to the research report that he may have due, it's overwhelming to just say, okay, you need to research the founding fathers. That's broad, right? So we're going to teach Tyler how to break that down. So we're going to start with maybe just basic names, date of birth, and then we're going to have him research what were the significant events they're related to, that kind of thing. So when Tyler has an assignment, he needs to bring it to the counselor, or again, if the teacher's willing to work with him, so we can break that down. And that's going to look different on different assignments. Some of them I know in geometry, they might be working on, I know they recently did it was like a house remodel. So they had a project where they had to break apart remodeling their home with area perimeter, that kind of thing. Giving that to a student with ADHD is just too much. So we need to help him break those tasks apart and organize those a little bit better. And then just a schedule or a list for daily things. So aside from those big things, they're going to have daily assignments that they have to keep up with. I would ask Tyler that he writes down daily activities or daily assignments that he needs to do. Maybe they do a daily bell ringer that's graded. Maybe they have a weekly quiz. I would like to see that in the planner. I would check it on Monday, check it again on Friday, ask Tyler, did we get those done? And then eventually we can gradually release that responsibility to where Tyler knows the expectation and we don't have to babysit it as much. And with him, I would also like to create goals that he can easily reach. So I'm not going to ask him to keep this binder perfect and write down every assignment initially, but we're going to do those baby steps, right? Start with the binder, check that. And then we're going to start with the organization list. So just kind of gradually build it all together and then give him the goal of the first week, keep the binder organized. When you bring it to me next Monday, I want to see it clean. I don't want paper shoved everywhere. I don't want to see science in an English folder, that kind of thing. And those are goals that he can easily reach on his own. And when he does, it's like, buddy, you did a great job keeping all those together. He's going to be more confident. He's, like, hey, I can do that. And a little side note, confidence is an issue with our ADHD kiddos because they're always, like we talked about, being fussed at or put down. Maybe we want to give them rewards as he meets certain goals. So maybe we give him a week that we want that binder completely organized and his schedule written out. If he does that, then he can have a reward of his choice. Maybe he wants 10 minutes extra, on his Chromebook or whatever. We can work through that based on the child's interest. Okay, let's look at the conclusion. So the skills and interventions provided can't alleviate symptoms of ADHD, right? We can't make them go away. But what they can do is help make it more manageable for the student, for the teacher, for the parents, and to gain more buy-in from the students to make them really want to go along with, keeping up with this binder and keeping up with their checklist. We need to explain the benefits to them and the reasons. We can just hand Tyler this binder and say, okay, we need to organize it. We're not going to get a whole lot of buy-in there. We need to explain to him the importance. Like, hey, buddy, we're losing stuff, or we don't have the grades that we want. So maybe this can help get you to where you want to be. So we need to give him the reasons and then the benefits of that. The use of group intervention is valuable in the school setting. The biggest reason right now are there limited counselors. So we have so many students and so few counselors. So this would be something, teaching these kiddos to organize. We could have a weekly meeting on Monday and we all put our binder together. And then on Friday we come back and we can have to kind of like peer editing. So we're not editing a paper, but we're editing each other's binders. We can look at those and say, Bobby, you really don't put your ELA in with your math. We can have the kids kind of help do that. And that's also teaching them. The best way to learn is to be the teacher. And then when we look back at the individual interventions, we have the caught being good game. So this is a positive behavioral reinforcement. All kiddos love that, especially these ADHD kiddos who are struggling already and who are often in trouble. This is a way to help boost their self-confidence. And then let's see. What was the last one, Tanya?
The check-in and check-out
Yes.
system.
Okay. The check-in, check-out. So, and that's something that we could use in group or individual. If you have a student who needs like that, a little bit of reinforcement daily, that teacher can check off, yeah, they did great, take it to your counselor and kind of gain that positive reinforcement there.
Yeah, absolutely. I think ultimately at the end, if it is individual or group, we just want to ensure all students feel that they can trust us and that we can be the support system and bridge that they need to be successful, no matter what the situation is or what the diagnosis is or anything that the student may be going through. So,
right. And again, our goal is to, just help alleviate these symptoms. We can't fix it, and our assumption is maybe our kiddos aren't medicated, maybe they never will be, but we want to give them the tools that they can take through life, carry them through life to be successful in careers in their future.
Absolutely. Here are just some of our references too. They're just on the slides. We got 10 of them, so.
Yep, those will be added in our handouts and each of our interventions and how we can implement them. You can also find those on our handouts.
Yes.
All right, are we good?